Hello and welcome. My name is Zafar Iqbal and you're watching the Mojo Story. Now, in the wake of rising COVID cases, the Delhi government has issued a fresh advisory for private schools. Now, according to the advisory, the government has asked if there are any infections which are noticed or reported. The school authorities must inform the directorate, and the concerned wing or the school as a whole must be closed. Uh, now, uh, Now there are also certain measures that have been asked to be taken, which is of course wearing of masks by students, teachers, and the staff, and maintenance of social distancing, and regular washing of hands, and use of sanitizers, and the COVID awareness. That's always been the case. So we've been seeing ups and downs as far as this COVID situation is concerned. Obviously, over all these uh, months, we've been seeing different waves really hitting the country and the country's response also. To discuss more, we're joined by an eminent panel. We're joined by Dr. Vinita Bal, who's a scientist, and Dr. Ishwar Gilada, who's an infectious disease expert, and Simran Khara, who's a parent. Now, uh, obviously, let's start with the parent first. What's the sense you make, Simran Khara, of this new advisory? Parents have been sending their children to the schools after a pretty long time, and suddenly this advisory has come in now.
Yeah, I'm very disappointed with the advisory, right? It was only on the 1st of April that Delhi schools actually went fully offline, right? So we've
Yeah.
sort of been able to handle this for a precious 2 weeks, right? And children have been out of school for close to 2 years. What I'm very disappointed with is the fact that we continue to sort of treat schools as this first to close bastion, right? We don't talk about any other aspects. We don't talk about shops or malls or restaurants or flights or travel. It seems to be that we are obsessed with sort of closing schools the moment we see cases, right? And I think really time has come. We're going to have to live with this. It's not possible for us to sort of shut down a school if there is one case and keep the children at home. Where is this going to lead? Eventually. So I'm deeply worried and concerned that we continue to put the kids last. That's my primary fear over here. I'm not a scientist, I'm not a doctor, but if we continue to always act in this manner, saying that there's a case, there's a spike, let's shut down the schools. It's not just unscientific, it's sort of deeply damaging to the children. I am now worried.
Yes, obviously, as a parent, you would be worried, but we have doctors on the panel. You said you're not a doctor, but we have doctors, Dr. Ishwar Kilada. What's the sense you make of this new advisory?
The sense is nonsense because I think such people they live with advisories as their multivitamin. They cannot stay without advisories. Whenever it is required or not required, they want to give advisories or advices. Secondly, let us understand first the current situation. India is
Yeah.
in such a good situation. Just escalation of a few two-digit, three-digit cases, it doesn't matter. India could digest close to 3 lakh, 3.15 lakh cases per day just 2 months before without much of any problem. So if our entire country is giving say 1,000 cases or 1,500 cases every day, it's not going to matter. What we should be bothered about is with the number of infections, what is the trajectory? How many of them require oxygen? How many of them require bed? How many of them require ICU or ventilator?
Yeah.
How many of them are dying? If you look at
Yeah.
globally also, currently 1 million cases are there in Delhi, out of which 3,000 are dying. So it is 0.3% death rate globally. In India, currently the death rate is 0.2%. And it is close
Yes.
to flu, which is a seasonal flu. Seasonal flu death rate is 0.1%. So COVID has come down from 2%, 2.3% to 0.2% death rate or infection mortality rate. I think it's a very, very good situation we are in. So I think we should not be bothered about the number of infections. Number two, if the parents are vaccinated, if the teachers are vaccinated, if the staff is vaccinated, nothing to worry because in children, as it is, Omicron is a very mild. In children, it is further mild. So if some child gets Omicron positive or COVID positive, nothing would happen. I remember my grandmother used to tell me that during measles days, almost maybe 70, 80 years back, when one child used to get measles, community people used to bring other 8, 10 children and keep in that room of that measles positive child, so that other children gets, thereafter they will not get. Same thing happened to India. Omicron has infected everybody. Currently, our if you just do an antibody test, you find out 90% plus people are positive. One of the antibody tests which is done in Mumbai, which takes care of both antibodies from vaccine and antibodies from infection, they found 99.8% people are positive. So that means we are so much immune now, will not get affected unless and until there is a more severe wave comes, unless until more severe virus comes, which is a different virus, which is like Delta or worse than Delta. Nothing is going to happen to us. So I think we should stop such advisories. And lastly, I would like to give example of Telangana state. Uh, Politically, it may be different than the different governments, but they opened up in August 2021 and they never closed down even during the Omicron wave. And today, Telangana is no different than any part of the country. So whether you close
Right.
down, whether you open up, it doesn't matter. And most
Right.
importantly, we should also look at the psychology of children. Already 2 years closure has created lots of havoc in the families. You visit the families of parents and grandparents where they have children, and you discuss with them what is happening with their children. So I think even if they get some COVID infection, fine, but they should not get psychological problem, because the problem will linger on for years and years, maybe decades.
Yes.
So I think we are
Yes.
not looking at those issues. We are just using advisories. And Delhi being a capital of the country, all newspapers, all channel, everything little bit happening. Fresh problem, this problem, escalation, school closed down. You're talking about close down the wing of a school. What wing? There are some schools which are just one room or two room schools. So you don't make such kind of nonsense out of such kind of adversaries. I think it is
You know,
most deplorable. We should stop this thing.
deplorable, say Dr. Ishwar Gilada says, and of course he also says that it seems that is a knee-jerk reaction situation seems to be in control. But why did this advisory come in then, uh, Vinita Bal, Dr. Vinita Bal? What could be the reason for government to come up with a fresh advisory again for schools and students?
I think it's an apprehension that
Yeah.
the Delhi government needs to be seen to be doing something. And also, if you look at the advisory, whatever I read, it seems to suggest that private schools in Delhi should do need to follow this advisory. It seems as if the government schools need not follow this advisory. I haven't figured out what is the difference, but one way of putting a twist to it or some logic to it is that it is considered that people who are, kids who are going to private schools, their lives, quote unquote, their lives are more precious than the kids who are going to government school. If that is the attitude, then it will be, there can be chances of backfiring, because well educated parents might go against it. And I actually completely agree with Simranji that this is destroying students' ability to learn and various problems that they are facing. But all I can think of, especially with this government versus the non-government or private school distinction that is being made, is that we told you. So don't blame us if there is an outbreak. Don't blame us if your child falls ill. And then we are not responsible because we had given these instructions. It's also the case that big private schools would have wings, so that something can be shut down. But I am completely with what Dr. Gilada said, that I remember getting mumps and chicken pox and measles, all sorts of things when I was 4, 5, 6 year old. And of course, there were no vaccines. Our lives were not as precious as today's kids' lives are. And that is why we were allowed to go. We got the chicken pox from each other and we survived. Probably we have lifelong immunity against those infections now. But that is not normally the case. All one can think of is that this is an ultra cautious, and we want to save our skin kind of attitude that Delhi government has been showing. Nothing more than that. I can't imagine a real rationale and to make a distinction between government schools and private schools also.
Simran, what there's no, there's a distinction here between the government schools and the private school. The advisory is for the private schools. What is the logic?
I mean, the Delhi government has really flip-flopped this last couple of years on all of this, right? Sometimes they portray that they really want the schools to open, but it's the lieutenant governor who's keeping the schools shut. Then they come up with such an advisory. Then Manish Sisodia will come out just a few minutes ago and say that there is no need to panic. So honestly, I don't believe that there's a real logic. It's exactly what doctor and the scientists here are saying, that this is the sort of save yourself, just sort of don't be responsible for anything, just say that we told you so. It's essentially to just create this panic, right? And play into the fear playbook, right? Because it's really suited people to play into this fear playbook, right? You just sort of say, not our problem, we told you that there are cases, you should have shut down your wing. um, I think this is again a classic case of sort of whataboutery of the ARP on education, where they are very, very happy to take the limelight, click pictures with various people, do MOUs and collaborations, and show happiness curriculum, but they're not fighting it out for our kids. And that doesn't mean that mothers won't. I will. I absolutely will not tolerate this any other closure. I mean, we've had unscientific closure for 2 years. We're not going to put up with it again.
Well, passing the buck, really sometimes telling people to be cautious, over cautious, sometimes telling them that there's nothing to be worried about. But Dr. Ishwar Gilada,
Exactly.
how can India
Yeah.
learn to live with COVID? Of course, it's not something that's happened just yesterday or a month ago. Now it's been a long time that we are dealing with this situation. How can we live with it now?
No, no, Zafar, if you talk about India, India has already learnt it.
Yeah.
This all political class or babus, they don't want people to live properly. Currently, COVID is so cooperative with human beings. It's lying so low. You see that in last 2 months we have elections in 5 states. We had Holi, we had socialization. You go to every travel, they're full. Airlines, trains, buses, everywhere.
Yes.
So much socialization. If there was really very bad COVID, people could have got stuck. But where are vulnerable people? If 90%, 94%, 95% people are already infected, have immunity, the remaining 4 5% possibly herd immunity, or they may be also infected, or they may be also having some kind of immunity, but it is not showing in testing. So I think we should go how the time is going on. We should open up everything. Even for masking, like Maharashtra, there is no mandatory masking. If at all you want to use, use. Nobody is going to stop you, but it is not mandated. And sometimes, it's like you have to challenge also. For example, once you get some allergy and you are given antihistamine, 4 5 days, 10 days you are taking. The one day you need to stop and see whether your allergy is settled down or not. Once it is settled down, you stop the medicine. So similarly, if you are unmasked, no COVID appropriate behavior going on, things are open up, still it is not escalating, that means we are in the same zone. And don't worry about Omicron, because Omicron has helped India. It's a variant of support to India. It is not variant of concern to India. It has not killed a lot of people. It has not put people into hospitals. So I think if you look at delta waves or alpha waves, they had a lot of problems. So in that kind of scenario, what we should do, we should be doing for the schools is, there are several vaccines. I don't know why there are so many agencies in the country. There are so many committees. CDSCO or DCGI has given license to so many vaccines. Where are those vaccines? I have not seen Zycodi, anybody who is getting Zycodi. I have not seen Moderna, anybody getting Moderna. I have not seen Corbevax, Covax, nowhere. So there are only two vaccines. So you go to restaurant, you ask for a menu. Menu is long. You select something, no, that is not available. So this is a nonsense thing. There are so many vaccines which are approved for children. Why children above 5 are not given vaccine? If children above 5 are given vaccine, that will help you in two ways. One is immunity through vaccine. Secondly, your confidence building mechanism that my child is vaccinated. So parents or teacher will not panic. But in this scenario currently, parents are not panicking, teachers are not panicking, politicians are panicking. So I think, as has been shown, that we want to do something, we want to show doing something. And secondly, all this media channels, newspapers, अब आपको कैसे लग रहा है, अब आपका कैसा होगा, अब कैसा करेंगे, तो लॉकडाउन कर देंगे. So they need to get that kind of lockdown scenario, school shutdown scenario. I think, I don't know why we are going into that regressive phase again. We should be progressive. You look at East and look at the West, they are really bad. That is not going to affect India for several ways. That can be another program to show why East and West will not affect India. but India is lying low unless until new variant comes, which is a variant of concern and as serious as Delta or similar or more than that, you should not have any problem at all. Whether it is
Dr.
XE or
Gilada,
XF or XD, nothing will help, nothing will deter us.
Dr. Gilada raised some important points that where are the vaccines? Why aren't children being vaccinated? Of course, these are questions that people are asking, Dr. Vinita Bal.
Are asking, and those are really relevant questions. So there are 2 points that we need to think of
Yeah.
based on what we have been discussing. That the advisory is one thing, but there should be a surveillance system so that it's not just in the school children, but it's also in the adults, that there will be some infections taking place here and there would be small outbreaks like what was happening in Noida. I think there was a report of some 10-15 cases in a school with 2 teachers also being infected. And I understand that that is something that is a concern. But if you have a good reporting system, good surveillance system, then controlling such small outbreaks is something that should be easily doable. And we don't necessarily have a surveillance system in place, a good epidemiological and public health system in place, which is a major problem with India. So that is something that we don't have. We need to, the government needs to take this much more seriously. The second point is, of course, about the vaccines. And I completely agree that it's looking sort of like a mystery that there are these vaccines which have been available or they have been approved, but for one reason or another, they are not being available to children. So once we have, so Covaxin is available, but and was being given to age group of 15 to 18. And for convenience sake, for Corbevax could have been slotted for say 12 to 15 age group, not because one is better than the other, but it's a matter of convenience. If both vaccines are equally good, Covaxin and Corbevax, then just distribute them so that there is no confusion about who is going to get it. And this is something that, again, we have not managed. We, as in the vaccines, are not manufactured by the government. They are by the private sector. So our infrastructure or our pharmaceutical companies or private sector is also not coming up to the expectation. Are there technical difficulties, technological difficulties, distribution difficulties? Is it the question of pricing that government is asking them for lower price and they are not willing, and so on and so forth? But vaccine should be made available very urgently to children wherever there has been approval, to 5 to 8 or 8 to 10 or 8 to 11, whatever is possible. That should be our priority. And as I said, as somebody who is not in the government, does not know what is happening and why we do not have vaccines for the children.
For confidence, Simran?
So,
Sorry, if you could just repeat that.
I'm saying that if there are vaccines made available for the children, and that could give some sort of a confidence to the parents before they send their children to school.
Yeah, I think there is, honestly, I think there is now a growing voice of parents who want to send their children to school, whether or not vaccines are available. But I think vaccines will definitely help certain parents who want to administer it, right? However, we can't wait for vaccines alone. There's also a 3-year-old who needs to go to a preschool, and there may be no vaccine for that 3-year-old. But the most important thing that his parent can do today is send him to preschool, because he's missing out on so much socialization, if he or she doesn't go. So I think, more than the vaccines, I think we need to move away from this sort of sensationalize a COVID case in a class system. We need to move away from this context to really talking about, oh, is it severe? Is it a new variant? If it's not a variant of concern, let's just get on with our lives. All of us adults are super selfish. We all make those choices. This advisory has come. Has it stopped us from, traveling, seeing a movie, going to a restaurant, going to office? No. But we want to sort of just curtail children's freedoms for this reason, right? And that is sort of what is deeply damaging to the kids, right? Where we need to shift the language from saying, there's a case in section 2A. No, that's not what is important, right? The important thing is that our kids are back to school. The variant is like doctor said over here, It is not of concern. It's actually a support to India. Let's just try and let the children have some normal childhood, right? They've missed out on a lot, right? In my daughter's class, about
Yeah.
25% of her class, she's a 6-year old, 25% of her class has eyesight problems now. That's
Yes,
just the most
because
tangible
they
impact.
all of them are doing their classes on the smartphones or on the laptops, and that's putting strain
Precisely.
on their
two
eyes.
years right 2 years, right? There's obesity, there's mental health issues, there's emotional issues, right? We've really got to solve those challenges. How about we talk about those challenges versus sort of saying 325 cases in Delhi, let's shut down the schools, right? Because that's just the wrong messaging. And I think even there, media has to play a role, right? People have to be a little bit more responsible. It's important to report, but it's important to ask the right question. So 325 cases, so what? So what? You know?
Yeah. Dr. Ishwar Gilada, so what? 325 cases. It is a
And
spike, but so what?
no, sensationalization. I was on a channel just half an hour before, and when
Yeah.
I was in channel, the biggest news came, breaking news. One of the IPL person has been found COVID positive. Why you are creating a biggest news? If that IPL person or a cricketer is found COVID positive, what is the news in that? So I don't think we create why you create such kind of sensation. I think we should let it low. We should have any kind of advisories for how to cope up with the children's psychology, parenting, or what they are missing for, how we best we can entertain them, ask them what they require, create picnics for them, create some kind of stories for them. That we are not doing. We are just creating a scare after scare. And I think there'll be one time which will come, people will not listen to any advisories. Okay, these are the schools, etc., because they are scared of authorities. But otherwise, people are not going to listen to any such advisories of social distancing, masking, not going here and there, not socializing. How long you can ask them to have a COVID holiday or COVID fatigue? The people cannot. And secondly, when coming to vaccine, Government of India has paid 1500 crore to Biological E in June 2021 for
Yes.
50 crore vaccine, 30 crore vaccine at
Yeah.
the rate of 50 rupees per vaccine. Where are those
Yeah.
vaccine? This 1500 crore paid advance is from our taxpayer money. We paid those taxes. So I think we must have some kind of accountability to such kind of advance payment which are done. And where is the vaccine? Why it is not being used? And secondly, we should also do some kind of bridge trial or small clinical trial. Can vaccine work in 50% dose or one fourth of the dose in children? You cannot use the same dose which is being given for adult. So I think this smaller trial could have been done when the things are lying low. We should look at those kind of trial booster, which booster will work better. These are all small bridge trial for 100 200 people. Trial can be completed in 1 or 2 months time to look at efficacy of half dose versus full dose. And we have seen that in UK half dose has worked even in adults in Covishield or AstraZeneca, which was wrongly done half dose, but it worked better than full dose. So I think we should look at those things. And lastly, we should also look at, can this vaccine be combined with other childhood vaccination, so that every year, whenever it is required, if it is required, it can be given as a part of the other vaccination. There need not be a independent vertical vaccination for COVID.
Yes. Dr. Vinita, it may be a small spike, but nevertheless there is a spike. Is it something to do with the changed, mask mandates that it's not now very necessary to wear a mask? Could there be some relation with that?
I'm sure there is some contribution because
Yeah,
there is so much quote unquote normalcy pre pandemic time. But you also
yeah,
have to realize that a small spike from 209 to 292 to 350 are really small spikes.
yeah,
So, how much of apprehension should that create? And in those 235 or 325, how many kids have been found positive is also a relevant question. If they are not there, then should we be directing all our efforts to stopping children from going to school? Because these are the children who have not just these children, but school going, college going, all the kids who are going through their education have really suffered a lot over the last 2 years. So it's physical trauma as physical problems, like obesity and eyesight problems, as well as psychological problems. So this is the generation which has a very long life ahead. I mean, I will have probably, I mean, I will have much fewer years ahead to live. But this is a generation which, if it gets warped, then we will have really, really sad situation to face, because everybody, every school going and college going kid has gone through these 2 years of some kind of trauma. Very serious. I mean,
Yeah.
depends. There will be variation between how kids handle it, but this is the generation which is going to be affected so drastically over the years that we need to worry about it and get back to quote unquote normalcy as fast as possible. And this advisory is not really supporting that notion.
Yes, but Simran, as a parent, what do you think? What can parents and schools do together? We seem to have lost the line, but Dr. Gilada, what can be done to ensure the safety of the children? You know, on one hand, there are problems of eyesight, problems of obesity when they're constantly on the phones or on their laptops doing their classes, and on the other hand, you know, now there are fresh advisories coming in. It really puts a lot of mental strain to the parents as well as to the children. What can be done to get out of this trap?
You see, India has come a long way. We were
Yeah,
looking at hunger, roti kapda makan. Thereafter, we were looking at bijli nal pani. Now we are looking at psychology. When we are looking at psychology, that means in all other spheres we have done better. We are looking at some
yeah,
issues which are psychology and mental health. So under this situation, we should have some kind of study to be done on children, what they have lost during 2 years, how they can be compensated in that way. Secondly, we should also advise the governments properly, so that government should not take any kind of measures like that. And Kejriwal government is famous for taking public people mandate. So before doing any such thing, they should take a people mandate if it is required. Otherwise, there'll be all kind of anarchy created unnecessarily out of nothing. If there's a real problem, yes, do it. But there's no real problem, don't do such kind of things which are going to be regressive, and they will put children again in problem, both children and parent. Currently, it is not only children problem, children and their parents problem. As a grandparent, I know how much my daughters go through that because of the children could not go to the school. So everybody suffers. It is not only children suffer, and we should understand all those things. And mental health, and government of India's program shows that mental health has been given a special demarcated fund this time in the budget. But I don't know whether it has come in practice or not. So we should try to develop that issue, and a major chunk of that should be spent on children, the mental health of children and parents.
Simran, what are few measures that you would advise the administration and the government to do in this situation when you're faced with a situation that that children are constantly on their phones, on their mobile phones, doing their online classes. On the other hand, when they start going to the schools and there is this advisory, you know, there's a lot of confusion. What are the few measures that you would want the administration to take to really resolve this issue?
Yeah, I think firstly, we need to take, school closure outside of the graded response action plan, right? Because we follow the GRAP very, very conveniently. We pick whatever we want to pick from it, and we make
Yeah.
sure that, the moment positivity crosses 0.5%, technically the government can, shut down schools, right? Which is not true anymore. I mean, this metric doesn't make sense. This TPR metric doesn't make sense today, just given our vaccine coverage, just given how much exposure people have had already to COVID. So we need to really take schools out of GRAP. We need to restore normalcy to children's lives, right? And we need to know that kids are not at the table. They're not a vote bank, but they are truly our future. And these kind of closures are going to create a lost generation. We have to be
Well,
very careful and tread very carefully, right? Because every time you do a disruption, even if it is for 2 weeks, yeah, it's devastating for children.
kids are not a vote bank, they are our future. You know, important words by Simran. Of course, there should not be a knee jerk reaction from the administration or passing the buck that, look, we told you, we have done our job. Perhaps a more holistic approach need to be taken by everybody, by the administration, by the doctors, and more importantly, by the parents and the children. That's all we have in today's show. Thanks to our panel, and thanks to all of our viewers for watching us. Thank you.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.